Hi! In today's video I'll be talking about the pros and cons of an epidural. About 60% of women will opt for an epidural in labour. It's a personal choice and it's up to you to weigh up the advantages and disadvantages of having one so that you can make an informed choice on the day as to whether it's the right option for you. My name's Anja and I'm a hypnobirthing antenatal class teacher. For more educational videos like this, please hit the subscribe button because I upload new videos to my channel every single week and I don't want you to miss any. So first, let's dive into the main advantages of having an epidural in labour. So an epidural is a nerve blocker and one of the best chemical pain relief options for labour. If you struggle with labour pain or discomfort, an epidural will usually numb you from the waist down so that you don't feel your contractions anymore. The great thing about having an epidural is that it works quickly and can relieve pain within 10 minutes of being administered. Having an epidural can be really useful if your labour has been long. A long labour can result in you being awake for hours and hours, maybe even days without getting any sleep. Having an epidural will ensure that you can rest, relax and even get to sleep before it's time for you to push and give birth to your baby. An epidural has no effect on your mental clarity in labour. Other injected forms of chemical pain relief such as pethidine or diamorphine can affect your mental state, make you feel disconnected from your birth experience and possibly a little bit out of it during the birth process. An epidural is also useful in labour if you require some sort of instrumental assistance such as the use of forceps or vacuum extraction to deliver your baby. Because you'll be completely numb down there, you don't have to worry about feeling the forceps or the vacuum extraction device being inserted. Now let's move on to the main disadvantages of having an epidural in labour. Epidurals can lower your blood pressure in labour and lead to less blood and oxygen flowing around your body and down to your baby in the womb. So if you experience a sudden drop in blood pressure after having an epidural, you may need to receive extra assistance such as extra oxygen, extra medication and fluids to reverse the side effects of having an epidural. Epidurals can sometimes make you feel itchy, feverish and sometimes a little bit shivery, and also when the epidural needle is removed from the bottom of your back you might feel sick or even be sick. About 1% of women will experience a severe form of headache and that's caused by a leakage of spinal fluid in the body. Having an epidural can make pushing more difficult because you may not be able to feel your contractions when it's time for you to give birth. As a result, you can't push effectively and you can't get yourself into gravity-friendly positions to help guide your baby down your birth canal smoothly. Women who have an epidural in labour will often give birth to their babies lying down on their backs in a hospital bed, and this isn't conducive to giving birth smoothly and comfortably. You can't get yourself into an active gravity-friendly position such as being on all fours or kneeling over the side of a bed or a birth pool. What you do when you give birth on your back is you push your baby uphill to get them earthside. Because you're not working with gravity, your baby can sometimes get stuck and it's harder for you to push and deliver your baby successfully. Because of this, it increases your chances of needing instrumental assistance such as forceps, ventouse, episiotomy or even a C-section. Thank you so much for watching this video today. I hope you found the information useful. Do share this video with a pregnant friend of yours if you think it can help them. If you have a question about epidurals, please let me know by leaving me a comment below and I'll get back to you as soon as I possibly can. Thank you so much for supporting my YouTube channel, thank you in advance for subscribing, and for more information about my hypnobirthing classes and online courses, please see the links in the video description below. If you're keen to sign up to a free online hypnobirthing taster session, I run 2 every month, please also see the links in the video description below. Take care and see you again soon. Bye!